Hello, and welcome to Module 13. In this session, we'll be diving into cellulitis and soft tissue infections, a critical topic for all wound care professionals. While wounds themselves pose serious challenges, the infections that can follow are often more dangerous. Cellulitis and related soft tissue infections can progress rapidly, impacting not just the skin, but deeper tissues, lymphatic circulation, and even leading to life-threatening complications like sepsis. As frontline caregivers, your role in identifying, treating, and escalating these conditions early is absolutely vital. So let's begin our exploration into these potentially serious but manageable complications. By the end of this module, you will be able to define cellulitis and other soft tissue infections, including erysipelas, abscesses, fasciitis, and myositis. Recognize clinical signs and symptoms that help differentiate between superficial infections and those that require urgent intervention. Identify high-risk patients, especially those prone to complications like delayed healing or sepsis. Understand the diagnostic tools used to confirm infections, including imaging and lab tests. Apply nursing interventions effectively, including wound care, documentation, escalation protocols, and patient education. This knowledge is essential to protect your patients from deterioration and hospitalization. The rising concern of soft tissue infections. Soft tissue infections are one of the most common complications of chronic and acute wounds. What may start as mild inflammation or redness can swiftly become severe, especially in high-risk populations. Why is this important? Because infections like cellulitis don't just stay local. They can spread to lymph nodes, bloodstream, and even underlying fascia or muscles, leading to serious outcomes like necrotizing fasciitis. Patients with comorbidities like diabetes, cancer, lymphedema, or those on immunosuppressants are particularly vulnerable. As a nurse, you are often the first to observe subtle changes. Your quick action in recognizing infection signs and beginning supportive care or escalation can literally save a life. Let's break down the types of soft tissue infections. Cellulitis is a diffuse, spreading infection involving the dermis and subcutaneous tissue. It's typically caused by bacteria like Streptococcus or Staphylococcus. It often presents without a clear margin. Erysipelas is more superficial, often affecting the upper dermis and lymphatics, with well-demarcated edges. It's more common in elderly patients and often involves the legs or face. Abscesses are localized collections of pus surrounded by inflammation. They may require incision and drainage rather than systemic antibiotics alone. Fasciitis and myositis are deep infections involving the fascia, connective tissue, and muscle, respectively. These are medical emergencies and require urgent surgical evaluation. Understanding which type of infection you're dealing with helps determine the urgency and type of treatment. For example, cellulitis may respond to oral antibiotics, while fasciitis needs immediate debridement and broad-spectrum IV antibiotics. Why do these infections happen, and who's at risk? Common pathogens. Group A Streptococcus, GAS, the most frequent culprit. Staphylococcus aureus, including MRSA, methicillin-resistant Staph aureus. In diabetic or immunocompromised patients, you may also encounter gram-negative rods and anaerobes, especially in polymicrobial infections like those in foot ulcers or surgical wounds. Patient-related risk factors include diabetes mellitus, obesity, chronic venous insufficiency, peripheral arterial disease, lymphedema, immunosuppression due to medications or chronic disease. Environmental behavioral triggers include trauma or breaks in skin integrity, fungal infections like athlete's foot, poor footwear hygiene, inadequate wound care, exposure to contaminated water or animal bites. By identifying these risks early, you can implement preventive strategies, educate your patients, and be proactive in management. How does cellulitis present? What should you look for? Local signs: redness, erythema that spreads over time, warmth, swelling, edema, tenderness or pain, shiny taut skin, especially in the legs, blistering or peau d'orange texture, orange peel-like skin. On palpation, you might feel induration, a firm, hardened area, fluctuance if pus is forming systemic signs that indicate progression, fever and chills, malaise or fatigue, lymphangitis, red streaks moving toward the lymph nodes, lymphadenopathy, enlarged lymph nodes nearby, tachycardia, hypotension, or confusion in elderly patients. These are sepsis red flags. If these signs are present, start empiric antibiotics immediately. Don't wait for cultures if sepsis is suspected. Also remember, in patients with diabetic foot ulcers or pressure injuries, clinical signs may be subtle or masked, so you must assess the entire patient, not just the wound. Now let's dive deeper into complicated soft tissue infections, how we diagnose and manage them effectively. Most cases of cellulitis are diagnosed clinically, meaning a skilled assessment by an experienced healthcare provider is often enough. However, if the wound has exudate or pus, a wound swab for culture and sensitivity can guide antibiotic choices. In patients showing signs of systemic illness, like fever or chills, or those who are immunocompromised, blood cultures become crucial. They help identify if the infection has spread to the bloodstream. We also rely on basic laboratory tests like CBC, complete blood count, to check for elevated white blood cells, CRP, C-reactive protein, and ESR, erythrocyte sedimentation rate, to monitor inflammation levels. But when we suspect a deep space infection, like an abscess that's not visible, or something more severe like necrotizing fasciitis, we turn to imaging. Ultrasound can detect hidden abscesses. CT scans or MRIs can help us evaluate deeper tissue involvement. Watch closely for complications. Recurrent cellulitis, especially in the legs. Necrotizing fasciitis, which can destroy tissues rapidly. And most dangerously, sepsis. Be alert to early signs of systemic deterioration, increased heart rate, confusion, low blood pressure, or rapidly worsening skin changes. Early recognition and escalation can be life-saving. So, how do we treat cellulitis and related infections? Treatment depends on the severity of the infection. Mild to moderate cases. Typically treated with oral antibiotics for 5 to 10 days. Amoxicillin clavulanate is commonly used. If MRSA is suspected, doxycycline or clindamycin might be added, severe or systemic cases. These require hospitalizations and IV antibiotics. Common choices include vancomycin, ceftriaxone, or linezolid. Nurses should monitor vitals, ensure fluid balance, and observe mental status regularly. Abscesses. The gold standard is incision and drainage. Antibiotics are only added if there's associated cellulitis, systemic symptoms, or in patients with weak immune systems. Always monitor response to treatment. If there's no improvement within 48 to 72 hours, it's time to reevaluate. Maybe the cause is resistant bacteria, or there's a hidden abscess. Treating cellulitis once is only half the battle. The real challenge lies in preventing it from coming back. Here are some key prevention strategies. Checkmark. Skin care. Dry, cracked skin creates easy entry points for bacteria. Encourage daily moisturizing, especially for patients with eczema or dryness. Fungal infections. Athlete's foot or toenail fungus can be silent culprits. Always treat them to prevent recurrent cellulitis. Lymphedema management. Patients with lymphatic swelling should use compression therapy and elevate the limb regularly. Prophylactic antibiotics. If a patient has 3 or more cellulitis episodes per year, consider preventive antibiotics after physician consultation. Lifestyle management. Control blood sugar in diabetic patients. Encourage weight loss in overweight individuals. Promote proper footwear and hygiene, especially for those with neuropathy or circulatory issues. As nurses, we stand at the front lines of infection detection, treatment, and education. Let's look at your key responsibilities. Assessment. Look for changes in skin color, temperature, swelling, or drainage. Measure and mark wound borders to monitor progression. Documentation. Record the location, size, color, and evolution of the infection. Note systemic signs like fever, chills, or malaise. Medication management. Administer antibiotics as prescribed and watch for side effects like rashes or GI upset. Supportive care. Elevate the limb to reduce swelling. Encourage gentle mobility to maintain circulation. Patient education. Teach wound care basics, hygiene, dressing changes, and infection warning signs. Reinforce the importance of completing the full antibiotic course. Escalation. If no improvement in 48 hours, or if symptoms worsen, report to the medical team immediately. Education is your most powerful tool in preventing recurrence and complications. Teach patients and caregivers to complete the antibiotic course, even if symptoms resolve early. Elevate the limb to reduce edema and improve healing. Inspect skin daily for new cuts, redness, or blisters. Wear appropriate footwear and avoid walking barefoot. Never shave over swollen or inflamed areas. Red flags that demand emergency care. High fever, fast heartbeat, confusion or drowsiness, rapidly spreading redness or pain. Empowering patients with knowledge helps them take charge of their healing and prevents repeat infections. To wrap up this module, let's reinforce the core message. Cellulitis and soft tissue infections are high risk but highly manageable if detected early and treated appropriately. You, as a nurse, are essential to this process. From careful assessment to patient education and escalation, you are the eyes, ears, and advocates for your patients. Through evidence-based care, strong communication, and a proactive approach, we can prevent life-threatening complications like sepsis and necrotizing infections. Thank you for your dedication, and remember, early action saves lives.